Long before pharmaceutical companies, long before hospital waiting rooms, and long before pill bottles lined the shelves of every drugstore, there was a people who had already figured it out. The Cherokee Nation, one of the largest and most sophisticated indigenous civilizations in North American history, developed a medicinal system so advanced that over 400 plant species were documented in their healing practices. And here's the part that should make you sit up straight. Many of the drugs we rely on today were originally derived from plants the Cherokee used centuries before modern science discovered them. So today, we're pulling back the curtain. These aren't myths. These aren't folk tales. These are historically documented, scientifically studied remedies from one of the most remarkable traditions of natural medicine the world has ever known. Here are 11 Cherokee remedies that doctors will never tell you. Before we dive in, a quick note about respect and accuracy. The Cherokee people, both the Eastern Band in North Carolina and the Western Band in Oklahoma, have maintained their healing traditions for generations. Their medicine is deeply tied to culture, ceremony, prayer, and a profound relationship with nature. This video honors that heritage by sticking strictly to what has been historically documented and scientifically reviewed. A landmark study published in the journal Nutrients in 2018 reviewed Cherokee ethnobotanical records and matched them against modern phytochemical research. What they found was remarkable. The traditional uses of these plants aligned consistently with what modern science later confirmed. Let's get into it. Remedy 1. Yarrow Cherokee use. Used as a wound, healing agent, and blood-clotting plant. Picture this: a warrior in the forest, a deep cut, no hospital for hundreds of miles. What did the Cherokee reach for? Yarrow. The Cherokee applied fresh-cut yarrow leaves directly to open wounds to stop bleeding. A practice that has now been confirmed by modern research. Yarrow contains compounds called acylane and flavonoids that actively support platelet aggregation and help blood clot faster. They also brewed yarrow leaves into a tea for digestive support and used decoctions of the leaves and stems to treat skin conditions like acne. Yarrow grows wild in fields, roadsides, and gardens across North America and Europe, and it has been used medicinally across cultures for thousands of years, dating back to ancient Greece. What science says, multiple studies confirm yarrow's anti-inflammatory, antimicrobial, and hemostatic properties. It is still used in herbal medicine worldwide today. Remedy 2. Black cohosh, Actaea racemosa, Cherokee use. Women's health, menstrual pain, childbirth support, menopausal symptoms, and joint pain. The Cherokee called on black cohosh for some of the most important moments in a woman's life. Cherokee midwives used it to ease labor, relieve menstrual cramps, and help women through the transition of menopause. It was also used in decoctions for rheumatism and back pain. What science says, black cohosh is one of the most studied herbal medicines in the world. The German Commission E, Europe's equivalent of the FDA for herbal remedies, has approved it for use in managing menopausal symptoms. Research confirms it contains compounds that interact with serotonin receptors, which may explain its effectiveness in reducing hot flashes and mood disturbances. Important caution. Long-term use has been linked to liver toxicity in rare cases. Always use under guidance of a healthcare provider. Remedy 3. American ginseng, Panax quinquefolius. Cherokee use. General vitality, energy, mental clarity, and as a tonic root. American ginseng has been one of the most prized plants in Cherokee medicine and was so valuable that it was historically traded and sold to herb merchants. The Cherokee used the root as a general strengthening tonic, what they called medicine for the whole body. What science says, modern research has identified active compounds in American ginseng called ginsenosides, which have demonstrated adaptogenic properties, meaning they help the body adapt to physical and mental stress. Studies have shown benefits for immune function, cognitive performance, and blood sugar regulation. Wild American ginseng is now classified as a threatened species due to overharvesting. Sourcing must be responsible and sustainable. Remedy 4. Golden seal Hydrastis canadensis, Cherokee use, eye infections, skin diseases, digestive issues, and as a natural insect repellent. Golden seal was so important to the Cherokee that it served multiple purposes. They used it as a wash to treat sore and inflamed eyes, applied it to skin infections, and even ground the root into a powder mixed with bear fat to repel insects. Its bright yellow color also made it a natural dye. What science says? Golden seal contains berberine, a powerful antimicrobial compound that has been extensively studied. Research confirms berberine has demonstrated activity against a wide range of bacteria, fungi, and parasites. Berberine has also shown promise in blood sugar regulation and is now used in various supplements and clinical studies worldwide. Golden seal should not be used during pregnancy and is also a threatened wild plant. Always choose cultivated sources. Remedy 5, Blue Skullcap Scutellaria lateriflora, Cherokee use anxiety, nervous tension, and as a relaxation and sleep aid. Long before anyone coined the term anxiety disorder, the Cherokee were treating its symptoms with blue skullcap, a plant native to North American wetlands and stream banks. They brewed it into teas to calm the nervous system, ease tension, and promote rest. What science says, published in the journal Nutrients, and reviewed in multiple phytochemical studies. Blue skullcap contains baeccalin and baeccalene, flavonoids with documented anxiolytic, anti-anxiety, and neuroprotective properties. A 2014 study published in Alternative Therapies in Health and Medicine found it significantly improved global mood without reducing cognitive performance. Remedy 6, Wild Ginger, Asarum canadense, Cherokee use, digestive complaints, nausea, gas, and stimulating appetite. The Cherokee used wild ginger root as a digestive tonic, crushing or brewing the root to ease nausea, stomach cramps, and intestinal gas. It was also used to stimulate appetite in those recovering from illness. What science says, wild ginger contains aristolochic acid precursors and aromatic compounds that have demonstrated carminative, gaze, relieving, and digestive. Stimulating effects in ethnopharmacological research. Important note, wild ginger Asarum canadense is distinct from culinary ginger Zingiber officinale. It should be used with caution and in small amounts, as excessive consumption has been linked to kidney concerns. Traditional use was always carefully measured. Remedy 7, Witch hazel, Hamamelis virginiana. Cherokee use, skin inflammation, swelling, sore muscles, and as an astringent wash. You may recognize this one. It's still on drugstore shelves today. But the Cherokee were using witch hazel long before any commercial brand existed. They brewed the bark and leaves into preparations to treat swollen, inflamed tissue, muscle soreness, and skin irritation. What science says, witch hazel contains tannins and gallic acid, which are proven astringents and anti-inflammatory agents. Today, it is an FDA-approved active ingredient in over-the-counter skincare and is commonly used for hemorrhoids, minor cuts, bruises, and skin toning. This is a case where modern medicine essentially bottled an ancient Cherokee remedy. Remedy 8, Boneset, Eupatorium perfoliatum. Cherokee use, fevers, colds, flu, and deep bone pain, the kind that comes with severe illness. The name itself tells the story. The Cherokee and later colonial settlers used boneset to treat the intense, deep aching pain associated with severe fevers, particularly the kind of whole body pain that comes with influenza. It was brewed into a strong tea to break fevers and stimulate sweating. What science says, modern phytochemical analysis has identified sesquiterpene lactones and polysaccharides in boneset that demonstrate immunostimulant activity. Research suggests it may stimulate white blood cell activity, which aligns with its traditional use for infections and fever. It is documented in the Manual of Cherokee Herbal Remedies and multiple ethnobotanical records. Boneset should be used carefully. It contains pyrrolizidine alkaloids and should not be taken in large amounts or for extended periods. Remedy 9, Bloodroot sanguinaria canadensis. Cherokee use, respiratory infections, throat ailments, and topically for skin conditions. Bloodroot, named for the vivid red, orange sap of its root, was used by the Cherokee to treat coughs, colds, and throat infections. Small amounts were taken as an expectorant to clear the airways. Topically, it was applied to certain skin growths. What science says, bloodroot contains sanguinarine, an alkaloid compound with confirmed antimicrobial and anti-inflammatory activity. Sanguinarine is today used in some dental products, toothpastes, and mouth rinses for its ability to inhibit plaque-forming bacteria. Research into its topical applications for skin conditions is ongoing. Significant caution. Bloodroot is potent and can be toxic in improper doses. Internal use is not recommended without expert guidance. Its traditional use was always in carefully controlled, small amounts by trained Cherokee healers. Remedy 10. Wild black cherry. Cherokee use, coughs, colds, respiratory ailments, and as a mild sedative, wild black cherry bark was a staple in Cherokee medicine for treating coughs, sore throats, and respiratory infections. It was also noted as a mild sedative, used alongside wild lettuce and hops for procedures requiring calming effects. What science says, wild black cherry bark contains prunicin, a cyanogenic glycoside that, in the small amounts present in a controlled bark tea, acts as a cough suppressant by mildly reducing the cough reflex, a mechanism similar to some modern cough medicines. This compound is the reason wild cherry flavor became a standard ingredient in cough syrups that are still sold today. The bark, leaves, and seeds contain higher concentrations of cyanogenic compounds and must not be consumed in large quantities. Traditional use was carefully calibrated. Remedy 11. Passionflower Passiflora incarnata. Cherokee use, anxiety, insomnia, nervous exhaustion, and as a calming tonic. Passionflower was one of the Cherokee's most valued plants for mental and emotional well-being. The root was brewed into teas and used to calm an overactive mind, ease anxiety, and promote restful sleep. What science says, passionflower is among the most scientifically studied anxiolytic herbs in modern research. It contains chrysin and other flavonoids that interact with GABA receptors in the brain, the same receptors targeted by anti-anxiety pharmaceutical medications. Clinical study published in the Journal of Clinical Pharmacy and Therapeutics found passionflower extract to be as effective as oxazepam, a prescription sedative for treating generalized anxiety disorder with fewer side effects. This is perhaps the most striking example of how far ahead Cherokee medicine truly was. So here's what we've learned today. The Cherokee didn't stumble upon these remedies by accident. Their healers, medicine men and women, trained for years, observed nature across lifetimes, and built a system of plant medicine that was effective, sophisticated, and in many cases ahead of its time. The practice of traditional Cherokee medicine is still a viable, functioning tradition today, and many of these plants continue to be studied in modern pharmacological research. But here's the important takeaway. This knowledge wasn't a secret, it was shared. Many early European settlers learned from Cherokee healers. Modern pharmacology is drawn directly from indigenous plant knowledge across the Americas. If you want to explore any of these remedies further, look for peer-reviewed studies, consult a licensed herbalist or integrative medicine physician, and always respect the cultural tradition from which this knowledge comes. If you found this video valuable, share it with someone who needs to hear it. Subscribe for more deep dives into the history of natural medicine, traditional healing, and the science that's finally catching up to ancient wisdom. Stay curious, stay well, and we'll see you in the next one.